Welcome on back now, 6:44 in your Capital Watch. We are less than 6 weeks away from health insurance premiums increasing for millions of you, especially those who get their insurance through the Affordable Care Act marketplace. Now, the White House, as well as leaders in Congress, they're signaling interest in a health care reform bill that could be voted on before the end of the year. So what ideas are being discussed and how might they impact your wallet? Scripps News Group national correspondent Joe St. George reports.
Could the country soon be on the verge of a major health care policy debate that may make some health insurance plans cheaper? It's at least a possibility in the coming weeks here on Capitol Hill. So what are some of the ideas, and more importantly, could any of them become law? The cost of health care is one of the biggest issues facing the country. A recent Scripps News Talker Research survey found that 1 in 4 Americans report health care as their most important issue. An October AP NORC poll found about 6 in 10 Americans extremely or very concerned about health care costs going up next year. With Republicans controlling the House, the Senate, and the White House, the odds of any new health care policy change likely starts with conservatives who are actively talking about policy changes ahead of premium hikes for millions taking effect in January.
We've got to be a little bit more creative than just the federal government throwing money at it.
One lawmaker to watch during this debate is Republican Senator Bill Cassidy of Louisiana, a doctor himself. Senator Cassidy's plan is different from what Democrats want because Democrats want to send billions of taxpayer dollars to extend subsidies expiring in December related to insurance plans created by the Affordable Care Act. The Cassidy plan calls for sending that money to healthcare flexible savings accounts instead, so taxpayers can pay for costs related to their health. He recently explained his plan on the Senate floor.
It goes to an account that she controls, that she can spend on her physician, her dental care, her prescriptions. We need to empower her.
Cassidy says he is working with the White House on legislation and believes a vote is possible before the end of the year. President Trump previously endorsed a version of this, posting on Truth Social, the taxpayer dollars should, quote, be sent directly to the people so that they can purchase their own much better health care and have money left over. But many Democrats on Capitol Hill are skeptical of that plan and do not believe such legislation can pass before January. Democratic Senator Shaheen of New Hampshire, a key figure in this debate, is working with Republicans for an extension of existing Affordable Care Act subsidies, the same subsidies that were central to the recent government shutdown. Shaheen has indicated a willingness to potentially accept new income limits as part of a deal.
I'm 100% committed to getting this done.
Joe St. George, Scripps News Group, Washington.